Good morning. My name is Cristi Creal, and I'm an Afro-Latina full-spectrum midwife with the University of Utah School of Medicine Midwifery Division, Birth Care Healthcare, and an assistant professor at the University of Utah College of Nursing. For a little bit of background information, race-based health disparities continue in the United States despite directed and significant efforts. Regardless of age, income status, education level, or gender identity, people of color continue to fall victim to higher morbidity and mortality rates compared to white individuals. Black birthing people alone are 3 times more likely to die from pregnancy-related causes than white individuals. The urgent need to address these disparities in maternal health outcomes prompted a development of a clinical empathy toolkit, a collaborative effort created through the collective expertise of multiple authors across diverse disciplines, including myself, Dr. Karen Tao, Dr. Susanna Cohen, and Dr. Joanne Fall, entitled A Clinical Empathy Toolkit for Providers to Engage Patients in Discussions Regarding Race-Based Disparities Affecting BIPOC Pregnant and Birthing People. Considering race and ethnicity are entirely socially constructed, it is plausible that dismantling social perceptions by encouraging providers to be more vigilant through increased training could be an effective way to correct this injustice. Uncovering recurrent insults in the clinical settings can help providers better notice bias and thus begin the journey towards behavioral change. One pervasive problem is a lack of skills-based training for providers on A, how to recognize moments when issues of race and/or racism may be influencing patient-provider interactions, for example, race-based neglect or microaggressions. B, how to appropriately ask their patients to disclose moments when they may have experienced racial injustice within the healthcare setting. And C, how to empathetically discuss negative race-related incidents with their patients during clinical visits. Therefore, to address this gap in care, we conducted a quality improvement project to help providers become aware of their own racial implicit bias and address patient experiences of racism. We developed an educational toolkit that encompasses 3 essential elements: strategies for cultivating clinical empathy, guidance for navigating cultural ruptures and repair, and training on integrating thickening questions to address this problem. Providers in a university-based midwifery practice received training on the toolkit and received electronic medical record EMR templated conversations and reminders to help facilitate dialogue that was integrated into standardized charting. To assess our project's effectiveness, usability, feasibility, provider satisfaction, and sustainability, participants completed anonymous pre- and post-training self-assessment surveys. As a result, a total of 15 providers participated in the training, and 18 providers used the EMR racial dialogue template and new patient encounters for 6 weeks. Post-intervention results indicated that 78.6% of providers increased comfort in addressing racial disparities and felt more prepared to address racial disparities with patients. 85.7% believed that this was an important issue to include during patient visits. And finally, 78.6% of providers indicated they intended to continue asking the question, do you feel like your race, ethnicity, or the color of your skin has affected the healthcare you received either today or in the past? Focusing on racial bias in clinical empathy and maternal healthcare is critical given the ongoing and significant racial ethnic health disparities among BIPOC pregnant and birthing people. Based on our findings, training specifically designed to increase provider clinical empathy and racial bias reduction skills appears to be a valuable resource. Providers developed skills and increased comfort in addressing racism directly with their patients. We learned that effective and feasible interventions require skills-based training and system processes, for example, our EMR templates. Additionally, we learned that it is feasible to address the issue of racism in healthcare with patients during a clinical visit. However, replication of this quality improvement project is needed to determine if similar improvements would be made among different healthcare providers and whether this type of intervention changes patient experiences or overall outcomes. This toolkit represents a pivotal step towards fostering meaningful discussions between healthcare providers and their BIPOC patients, navigating the intricate intersections of race, healthcare access, and maternal well-being. Drawing from insights rooted in both clinical practice and social justice frameworks, this project endeavors to equip providers with tangible tools and strategies to engage in empathetic, culturally competent care. Thank you for listening today, and let me know if you have any questions.